Jai Jinendra, Pranam, and good evening, everyone. Welcome to our Oshwal webinar, આપણો સાતમો વેબિનારનો ઇવેન્ટ છે. હવે આપણે જયેશભાઈ પાસે નવકાર મંત્ર સાંભળશું અને પછી આજનું આપણે વેબિનાર શરૂ કરશું. Thank you.
Om Namo Arihantanam. Om Namo Siddhanam. Om Namo Ayariyanam. Om Namo Uvajjayanam. Om Namo Lo Esabvasahunam. Eso Panchanamukaro. Sabbapavapanasano. Mangalanam cha Savveshim. Padhamam Havai Mangalam. Arhanto Bhagavanta Indra Mahita. Siddhascha Siddhi Sthita. Acharya Jina Shasano Natikara. Pujya Upadhyayaka. Trisiddhanta Supathika Munivara. Ratnatraya Radhika. Panchaite Parameshtinah Pratidinam. Kurvantu vo Mangalam. Kurvantu vo Mangalam. Oshwal Association of the UK તરફથી આપ સૌને પ્રણામ. આપ સર્વનું આરોગ્ય સુખાકારી સારી રહે અને ખૂબ સારા કાર્ય કરવાની શક્તિ દેવ ગુરુ અને ધર્મ પસાએ પ્રાપ્ત થાય એ જ પરમાત્માના ચરણમાં વંદના અને પ્રાર્થના.
Thank you, Jayesh Bhai. And so we are here today to talk about aches, pains, and management of pain. આ બધા અને ઘણા બધા લોકોને લાગુ પડતી વાત છે. આપણે દુખાવાની વાત કરીએ, ઘણી બધી એવી આપણે સમસ્યાઓ હોય છે જેનાથી આપણે દુખાવો થાય છે. અને આજે આપણે સાથે આ વાત કરવા માટે અહીંયા આવ્યા છે ડોક્ટર અનુજા શાહ. એ એક જીપી છે, એમની પ્રેક્ટિસ લ્યુટનમાં છે અને 25 વર્ષ થયા આ પ્રેક્ટિસ કરી રહ્યા છે. એન્ડ એની સાથે છે મેનકા પટેલ, જે ઓફકોર્સ તમે બધા જો લાસ્ટ સેશનમાં જોઈન થયા હશો તો તમે મેનકાને ત્યારે સાંભળ્યા હશે. અને એ વાત કરતા હતા ફિઝિયોથેરાપીની અને કેવી રીતે ફિઝિયોથેરાપી આપણે ઘણી બધી આપણી આ સમસ્યાઓમાંથી ઊભા કરી શકે છે. સો નોટ ઓનલી સર્જરી પછીની આ વાત છે, પણ નોર્મલ એક્સ પેઇન્સ જે ઘણા બધા આપણે સફર કરીએ છીએ. ઘણા બધાને નીઝના પ્રોબ્લેમ હોય, શોલ્ડર્સના પ્રોબ્લેમ હોય, અને એ પેઇનનું આપણે શું કરવું જોઈએ, ક્યારે શું કરવું જોઈએ, અને ખાલી મેડિકેશન્સથી મટે કે ફિઝિયો જરૂરી છે યા તો બીજી કોઈ ટ્રીટમેન્ટ જરૂર છે, એની આજે આપણે વાત કરશું. We are streaming live on Facebook today as well as YouTube. So don't forget, તમારા કોઈ questions હોય આજના panel માટે તો please એ questions તમે ત્યાં મૂકી શકો છો અને આ સેશનની એન્ડમાં આપણે Q&A માં તમારા બધા જ સવાલો લગભગ આપણે લઈએ છીએ અને એના આન્સર્સ panel તમને આપી શકશે. So without further ado, I'm going to introduce Tushar Bhai to welcome everyone. Tushar Bhai actually needs no introduction, so I'm going to let him introduce this today's session and welcome us. Thank you.
Thank you, Prafulaben. And Jai Jinendra Badao. Jen Prafulaben Kidu, today is our 7th session and a very important topic, aches and pains. Manlage se aje audience ma koi nahi hoy who has not gone through these difficulties. Mathu duik hoy, pag duika hoy, hath duik hoy, angri kapai gai hoy, whatever else it is. But we've all gone through these difficulties once in our lifetime, or if not once, more than once. Yeah. So today we got some exceptional speakers. Menka Ben has come back a second time. And Dr Anuja Shah from Luton teacher. So without further ado, let's listen to what they've got to say. Pachapre question and answer lesson. Of course, depending on the time, we will try and accommodate everybody's questions. So please bear with us. In case we get left out, we will try and do something about this in the future date. Yeah. Thank you. Prafulaben.
Thanks very much, Tushar. Yes, absolutely. Jetla questions apne answer kari kariye છીએ એટલે આપણે કરશું. Otherwise, of course, we can also give you replies via our mailbox. So ત્યાં પર તમે questions મોકલી શકો છો. So we're going to go towards our first speaker of the evening, Dr. Anuja Shah. She has been a GP with 25 years experience in surgery, as we said, Luton Marche, but she's actually a resident of Stanmore. Anuja is going to talk about the things that GPs currently are facing, the challenges facing GPs, but also our important topic, so aches and pains and its management. Anuja.
Thank you so much, Prafula, for that really kind introduction. Jai Jinendra Badhane, Pranam, અને તમને બધાને બધા સારા અને સ્વસ્થ હશો એ જ આશા રાખું છું. હું મારું સ્ક્રીન શેર કરીશ. So today I am, as Prafula mentioned, I am going to talk about aches and pains. Let me just... and I'm going to talk mainly in English, પણ વડીલો માટે હું ગુજરાતીમાં થોડોક સારાંશ આપવાની કોશિશ કરીશ. So this is a very important topic for us GPs. Aches and pains accounts for 30% of GP consultations in England and have an enormous impact on the quality of life of millions of people in the UK. And as Tushar mentioned, I don't think there's even one person who hasn't experienced some aches and pains in their life. They're also the most common reason for repeated consultations. So it actually is quite a big burden on general practice. And recently, during the pandemic, we have seen a surging increase in musculoskeletal problems in those working remotely from home, from their kitchen tables, sitting on their dining table chairs, cradling their phone with their shoulder and their neck, and all sorts. And we can imagine how, our bad posture can lead to aches and pains. And, we've seen a surge of consultation for these kind of aches and pains in general practice. Not only these, but other acute and chronic problems, along with delivering the vaccination program during the pandemic, has actually made it quite challenging for GPs. And as hospitals have either postponed or cancelled some of their services, this too has led to an immense strain on general practice. So, I'm really grateful for everyone to bear with us, in general practice. So talking of aches and pains, a lot of these conditions can be diagnosed with a very good history, and which can be taken on the video or on telephone. Let me give you some examples. So, what kind of history can your doctor ask you? The doctor may want to know how long you've had the pain for. Generally, the pain of osteoarthritis can be chronic, but you can have a flare-up of osteoarthritis. So if the pain has been there for many years, then it might indicate, kind of a long-standing problem such as osteoarthritis, or sometimes if the pain is a short duration, then it might be an inflammatory arthritis, something like rheumatoid arthritis. So, kind of these are the kind of questions that would help us. How did it start? The common arthritis, which is osteoarthritis, starts gradually. And the doctor will also want to know how it affects you. Does the pain impair your activities, such as walking or exercise, sleep? How you managing it at work? Your work, you might be a lorry driver, and if you have arthritis of the knee, it makes it impossible to be, climbing up and down the lorry, driving for such long distances. So how is your aches and pain? How is it impacting on your life? Are you able to participate in leisure or sport activities? all these things will help us manage your problem better. We also want to know if it's affecting your mood, your relationship, and what's the situation in your house. Also, where do you feel the pain? Generally, the pain of the common arthritis, which is the osteoarthritis, is in the load-bearing joints, which is the hips or the knees, but it can also be in the small joints of the fingers. What time of the day is the pain worse? We all know those mornings, when we find it really difficult to get out of bed, we're a bit stiff. But that can last a few minutes. As soon as you've come downstairs, prepared a cup of tea, your stiffness goes. But if the stiffness lasts for more than half an hour or up to an hour or so, then you've probably got what we call inflammatory arthritis or some kind of inflammation. Which can be which needs to be dealt with in a completely different way. And you may need a referral to the rheumatologist. Are your joints tender and swollen? So it is helpful to take a photograph, of your joints whenever they are swollen, because occasionally by the time you've spoken to or seen your doctor, the swelling might have gone. So if you have a photograph, that would really help us see how bad the swelling is. તો આપણે જોયું કે કેવી રીતના તમારા જીપી તમને મદદ કરી શકે છે કે તમારું જે શરીરનો દુખાવો હોય કે સાંધાનો દુખાવો હોય એનો નિદાન અમે તમને થોડાક પ્રશ્નો પૂછીને પણ અમે કરી શકીએ છીએ. ખબર પડી જાય કે કઈ જાતનું આર્થરાઇટિસ છે. જો તમને લાંબા ગાળાનો દુખાવો હોય તો કદાચ તમને ઓસ્ટિયોઆર્થરાઇટિસ હોય, અને જો તમને હમણાં થોડા દિવસથી જ દુખાવો થયો હોય અને ખૂબ જ તમારા સાંધા સોજી ગયા હોય, કે પછી તમને સવારે ઉઠીને તમને ખૂબ જ તમારા સાંધા સજ્જડ થઈ જતા હોય, તો એનો મતલબ એમ છે કે તમને ઇન્ફ્લેમેશન છે કોઈ જાતનું. So talking about the common form of arthritis, as I said, osteoarthritis, it is the most commonest arthritis in the UK and most commonest cause of pain and stiffness of the joints. Now, traditionally, we've always thought of osteoarthritis as wear and tear, which makes us feel as though, it's never going to get better. It's wear and tear. My body is giving up. It's never going to get better. But actually, that's not the case. And by making some changes in our lifestyle, we can lead a pain-free and a fruitful, a meaningful life. And we can enjoy life. We can enjoy activities. We can enjoy holidays. We can enjoy going places. So it's not something that's never going to get better. As part of normal life, our joints are exposed to constant low level of damage every day. Every day we have some kind of low level of damage. But in most cases, our body repairs the damage itself. And we do not experience any symptoms. Our body has this amazing power of actually repairing itself. Every day, our body repairs itself. But what happens in osteoarthritis is the body's ability to repair itself is impaired because of our lifestyle. Being overweight and inactive actually causes extra load on our joints, which prevents our joints from repairing itself. Our joints need to be kept active. They are active tissues, and they need to be kept active. And if we don't keep our joints active, they can get stiff. Just like a car which is meant to be driven, if it's not driven for many days or weeks, it's going to not start. It's going to refuse to start. It may be, kept in a beautiful showroom in pristine condition, but if it hasn't been driven, it's going to be very difficult to get it started. Just like that, our joints need to be kept active. And our sedentary lifestyle is not helping us, and definitely not helping the osteoarthritis. Some people may have mild pain with their osteoarthritis, and the pain may come and go, but others may have severe and continuous pain and may have difficulty in carrying out their daily living activities. The pain is generally worse on activity. As I mentioned earlier, it is the load-bearing joints, or the hips, the knees, which actually take the brunt of it, and they are affected most of all. But even the small joints of the hands are affected, and there is some metabolic cause for this. What are the different causes for osteoarthritis? We know old age, as we get older, our risk of having osteoarthritis or aches and pains in our joints is going to increase. But if you've had a bony injury in the past, if you've had any fractures or any other injury in the past, that may make us more prone to having osteoarthritis. A family history of osteoarthritis. So, Mara Ma baap ne arthritis hatu etle mane pan avse, and that is actually true. But we can do things to prevent, to make things better, and we don't need to suffer from the pain. Obviously, being overweight and obese increases the strain on the joints, the load that the joints have to take, and this increases the risk of osteoarthritis. And sadly, being a woman actually increases the risk of osteoarthritis. So it's just not fair being a woman. So આપણે જોયું કે આજે ઓસ્ટિયોઆર્થ્રાઇટિસ જે આપણે પેલા સાંધાવા જે કહેતા હતા, આ એક જાતનો આર્થ્રાઇટિસ છે જે ખૂબ જ સામાન્ય, બહુ જ કોમન છે. અને આપણા જે સાંધા છે એમાં થોડુંક એવું નાની નાની ઈજા થતી હોય છે. સામાન્ય રીતે આપણું શરીર એટલું બધું ભગવાને અદ્ભુત બનાવ્યું છે કે આ બધી ઈજાઓ એની મેતે જ મટી જાય છે. પણ જો આપણને આર્થ્રાઇટિસ, ઓસ્ટિયોઆર્થ્રાઇટિસ થયું હોય ત્યારે આ ઈજા ઘણી વખત આપણને મટતી નથી હોતી. અને એનું કારણ એ હોઈ શકે કે તમારું જો વજન વધારે હોય તો તમારા જે સાંધા છે, જે જોડ છે, એમાં દબાણ વધારે પડે છે. વજન વધારે હોવાના લીધે એમને વધારે સ્ટ્રેન, લોડ લેવું પડે છે. અને જો તમે એક્ટિવ ના હો અને તમારું જીવન બેઠાડું હોય તો પણ તમારા સાંધાઓને વધારે જોર પડે છે. એટલે કે આપણે વજન પ્રમાણસર રાખવાનું અને આપણે એક્ટિવ રહેવાનું. So, as a GP, how would I know, that what kind of arthritis has a person got? How would I assess the person? So, if the person is over the age of 45, and if they have pains which is worse when you use them, then it indicates osteoarthritis. So you will see just from the history, I can get a lot of information. X-ray and blood tests are not always necessary, but sometimes they can be helpful to rule out other possible causes of arthritis, such as inflammatory arthritis, rheumatoid arthritis, or even a fractured bone. An X-ray would not give me a lot more information, if I already knew that this person probably has arthritis. And hence, your GP may or may not request an X-ray, depending on what they think. Your doctor would also want to know if your pain is having an effect on your daily activity, your mobility, your exercise, your sleep, work and leisure activities. So they may assess you in that sense, that how is it affecting your daily activities? How is it, and that way we can tailor the management, the treatment to that. So tamara GP તમને કદાચ એક્સરે અને બ્લડ ટેસ્ટ માટે મોકલે, પણ આ જરૂરી નથી. જો તમારા જીપીને એમ ખ્યાલ આવી જાય કે તમને ઓસ્ટિયોઆર્થ્રાઇટિસ છે, તો કદાચ તમને બ્લડ ટેસ્ટ માટે ના પણ મોકલે. પણ ઘણી વખત બીજા કોઈ દર્દ નથી એમ જોવા માટે કદાચ તમને બ્લડ ટેસ્ટ કે એક્સરે માટે મોકલી શકે છે. So how would we manage osteoarthritis? There are a number of treatments available to reduce the pain, but weight loss, if overweight, is one of the best things that you can do for yourself. If you are overweight, if you lose weight, even if you lose 2 kilos of weight, that is that much less weight on each of your joint. So the load that the joint needs to take has already reduced, and any amount of weight loss is helpful. But obviously, being a normal weight is going to be immensely helpful for your joints. The reducing weight will reduce the load and the strain on your joints and help with the healing process that the joints have to go through. Exercise is one of the most important treatment for osteoarthritis, whatever your age or your fitness. And regular exercise will strengthen muscles and your joints. If you're in pain, you may think that exercise will make it worse. However, it will actually improve pain in the long run. Yes, initially it may be making it worse, but gradually as you increase the amount of exercise you do, it actually improves pain. Get Fit for Free NHS page gives lots of useful ideas for exercise, such as how to use the outdoor gym. Some people like to do the couch to 5K, and it's particularly for runners who are beginners for running. Couch to 5K, strength and flex exercise plans. And here in the UK, we are so fortunate to have all these amazing facilities. And, there's so many organizations who are so willing to help. And a lot of these facilities are free, or they have a very nominal charge. Me, for one, I can't wait for Parkrun to start so I can start, doing my 5K on a Saturday morning. And I do it along with my family, and it's amazing. It really gives me such a buzz. Wearing suitable footwear that absorbs the impact will help, because it absorbs the impact and your joints have that much less impact to take. Local heat and ice packs will also help with pain, and whatever helps. If you think ice is helpful in certain times when the joint seems inflamed and red, ice seems to help. Sometimes if it's stiff, heat seems to help. So whatever helps. The TENS machine, it sends electrical signals to the skin, which can help with the pain by numbing the nerves. Painkillers. Yes, painkillers are helpful, and we can start off with something like very simple, just like paracetamol, which will help with pain. Other anti-inflammatory drugs, such as ibuprofen, can be taken initially, I would suggest, in the gel form, particularly if it's for the knees or the hands. Certainly, the gel seems to work quite well. But sometimes they also can need to be taken orally if you're still in pain. If you haven't got contraindications, because some people cannot tolerate the anti-inflammatory drugs such as ibuprofen, particularly if you're asthmatic or if you've had a stomach ulcer, then you probably shouldn't be taking, if you're asthmatic and if you're allergic to them, most asthmatics can tolerate ibuprofen, but if you're allergic to it, you cannot take ibuprofen. But taken in the long run, they can have side effects. They can cause heartburn, and in the long run, they can also cause kidney and heart problems. So it needs to be taken with care, particularly if you're slightly older. You mustn't take ibuprofen on its own. You must always take it with something to protect your stomach. If this is not helpful, then sometimes doctors may prescribe a weak opioid along with paracetamol, such as codeine and paracetamol, and the combination called cocodamol is quite commonly used. But these can cause constipation, they can cause drowsiness, and if taken for a long period of time, in the long run, they can be addictive as well. The place for taking painkillers is actually along with the physical activity and exercise, so that it allows you to physical activity. It should not be taken just on its own. So painkillers are not there just to be taken to mask the pain. It should be taken so that it allows you to do all that physical activity, which will help you with the pain in the long run. And the other painkiller, which is very useful, is called capsaicin cream, which helps with the knee pain. And it basically is like a chili pepper gel, and it tends to tingle the skin, but it helps with the pain. And as I said, painkillers should always be taken along with an exercise program. તો તમને આર્થરાઇટિસ નો દુખાવો હોય તો તમારે ટ્રીટમેન્ટ માટે શું કરવું જોઈએ? તો પહેલા તો જો તમારું વજન વધારે હોય તો તમારે વજન ઓછું કરવાની કોશિશ ચોક્કસપણે કરવી જોઈએ, કેમ કે આ એક જ એવી વસ્તુ છે જેનાથી તમારા સાંધાને આરામ એટલે કે લોડ ઓછો થશે અને એ હીલ થશે. બીજું તમારે એક્સરસાઇઝ કરવી જોઈએ. મેં જેમ કહ્યું એમ લોડ ઓછો કરવાનો અને સાંધાને એક્ટિવ રાખવાનો. તો એક્સરસાઇઝ કરવાથી આ સાંધા તમારા એક્ટિવ રહેશે, તમારા મસલ્સ, તમારા જે સ્નાયુ હોય છે આ સાંધાની આજુબાજુ એ મજબૂત બને છે અને આના લીધે તમને દુખાવો ઓછો થાય છે. જો તમારે પેઇન કિલર્સ લેવી પડે આ એક્સરસાઇઝ કરવા માટે તો તમે લો પેઇન કિલર્સ ત્યારે લો, પણ એવું નથી કે ખાલી પેઇન કિલર્સ જ લઈએ અને બીજું કાંઈ ના કરીએ. જો આપણે એક્સરસાઇઝ કરવામાં દુખાવો થતો હોય ત્યારે પેઇન કિલર્સ લેવી જોઈએ. એટલે એક્સરસાઇઝ અને પેઇન કિલર્સ સાથે લેવી જોઈએ. એવું નથી કે ખાલી પેઇન કિલર્સ લઈએ અને એક્સરસાઇઝ ના કરીએ. Your GP can also refer you to other agencies to help with your arthritis or your aches and pains. And physiotherapy is one of the most commonly used agencies that for this kind of problem. Physiotherapists will give us advice on local muscle strengthening exercises and aerobic fitness training. They can also give you advice on how to pace yourself, how to balance rest and activity. So how you can pace yourself. They also give you ideas on how to integrate activities in your daily life, what you can do to integrate activity. So when you go shopping next, instead of taking the escalator or the lift, take the stairs. Integrate activity in your daily life all the time. Do your gardening, clean your house. All these activities will help. They can also offer protective joint support, such as splints or braces or gloves, sleeves, etc., to reduce the load on the joint. And they also can offer joint injection for moderate to severe joint pains. And Menka, I'm really excited to see some of the exercises that Menka is going to show us today. Occupational therapy is another agency that we use all the time, or we refer our patients to all the time. And they give us very valuable advice on assistive devices for our homes to reduce the repetitive load on our joints. They also give advice on walking sticks and other walking aids. They can give you other devices such as long-handed reachers or sock aids, which will help you reduce bending. Also aids for the bath, a raised toilet seat, a perching stool, half steps, grab rails, other adaptations to the home to improve mobility and reduce falls, because we know that osteoarthritis, as I said, stiffness of the joints can actually increase the risk of falls as well. For the hands, you can have grippers for writing, can openers, tap turners. So all these things are there, to make your life easier. A referral to podiatry will definitely help get some appropriate footwear and insoles, which, as I said, reduce the load on the joint and take some of the impact. So a cushioned footwear will take some of the impact on the knees. Specialist pain management, if your pain remains uncontrolled. So I often refer my patients to the pain clinic for specialist pain management. We know that if they're feeling a bit low, if you're depressed, if you're anxious, the pain sensation can be exaggerated. And vice versa. If we are in pain, we can feel anxious and we can feel depressed. And in these circumstances, a referral to a psychologist will really help. Cognitive behavioral therapy helps us kind of convert our negative thoughts into positive thoughts, and this really helps us cope with our aches and pains. Mindfulness helps us cope as well, and of course, a referral to the orthopedic surgeon for consideration of joint surgery if there is a significant impact on the joints, and it's not just limited to age. I've got a 50-year-old man who is a lorry driver, and he's got arthritis. Although his arthritis is not as bad as my 90-year-old patient, but it's really impacting on his life. So he's a perfect candidate for joint surgery. Exercise before the surgery is really crucial, because by exercising, you will increase your muscle strength, and also having an optimum weight, so making sure that you're not overweight before the surgery, will actually improve your post-operative outcomes, will make your post-operative outcomes a lot better. આર્થરાઇટિસ નો દુખાવો તમને હોય તો તમારા જીપી તમને ફિઝિયોથેરાપીમાં એક્સરસાઇઝ માટે રિફર કરી શકે છે, અને ફિઝિયોથેરાપી થેરાપિસ્ટ ફક્ત તમને એક્સરસાઇઝ નહીં પણ તમને બીજું પણ એવું ઘણું બધું તમને શીખવાડે કે તમે કેવી રીતના તમારા દુખાવાની સાથે તમે કેવી રીતના તમારી જે દૈનિક પ્રવૃત્તિ જે છે, જે રોજમંદુ જે જીવન તમારું છે એ તમે કેવી રીતના કરી શકો છો આ દુખાવા સાથે પણ. અને બીજું તમને ઓક્યુપેશનલ થેરાપિસ્ટ પણ મદદ કરી શકે છે. એ તમારા ઘરમાં જો કાંઈ પણ ફેરફાર કરવાના હોય, જેમ કે તમને પકડવા માટે ગ્રેબ રેઝ નાખવાના હોય, કે પછી તમારી ટોયલેટ સીટ ઊંચી કરવાની હોય, કે પછી તમને ચાલવા માટે લાકડી જોતી હોય, તો આ બધું ઓક્યુપેશનલ થેરાપિસ્ટ જે ઓટી આપણે કહીએ છીએ એ તમને કરી આપે. એ લોકો નળ માટે પણ એવા ડિવાઇસ નાખી આપે જેનાથી તમને નળ ખોલવા ઈઝી પડી જાય જો તમને હાથમાં આર્થરાઇટિસ હોય તો. બીજું જે પોડાયટ્રિસ્ટ હોય એ આપણા પગનું ધ્યાન રાખતા હોય, એ તમને સારા એવા શૂઝ ફૂટવેર માટે મદદ કરે છે. અને જો તમને દુખાવો એટલો બધો હોય કે તમને કોઈ પણ પેઇન કિલર્સ લાગુ ના પડતી હોય અને એક્સરસાઇઝથી પણ તમને દુખાવો ના મળતો હોય, તો અમે તમને સ્પેશિયલાઇઝ પેઇન ક્લિનિકમાં પણ અમે રિફર કરી શકીએ છીએ. ઘણા લોકો જેને થોડુંક આ દુખાવાના લીધે માનસિક રીતના થોડુંક એમને તણાવ રહેતો હોય, એન્ઝાયટી, ડિપ્રેશન રહેતું હોય, તો એ લોકો માટે પણ અમે સાયકોલોજીસ્ટને રિફર કરીએ છીએ. અને ઘણા લોકોને ઓપરેશનની જરૂર પડે છે તો અમે સર્જન્સ પાસે પણ અમે રિફર કરી દઈએ છીએ. પણ ઓપરેશન કર્યા પહેલા પણ એક્સરસાઇઝ કરવી ખૂબ જ જરૂરી છે, અને જો તમારું વજન વધારે હોય તો એ વજનને ઓછું કરવું ખૂબ જ જરૂરી છે, કેમ કે એનાથી જે તમારું જે ઓપરેશન થવાનું છે એનો પરિણામ ઘણો સારો આવશે. At last, I'd like to just tell you about some of these really useful resources. So Versus Arthritis and Patient Info. These provide really useful leaflets on common musculoskeletal conditions. Escape Pain app and online, Escape Pain online. They have some really useful self-management advice and advice on coping with the arthritic pain using exercises. The NHS sites, NHS UK, Osteoarthritis, and free fitness ideas. Definitely, I recommend everyone to visit this NHS page, free fitness ideas. I was amazed to see all the different ideas, that there were, which I definitely am going to incorporate in my life. તો તમને જો વધારે જાણકારી જોતી હોય તો તમે વર્સિસ આર્થરાઇટિસના વેબ પેજ ઉપર જશો ત્યાં આગળ તમને ઘણી બધી જાણકારી તમને આર્થરાઇટિસના વિશે અને એક્સરસાઇઝ તમે કેવી રીતના કરી શકો છો એ બધાની પણ તમને જાણકારી અહીંયા આગળ મળશે. તો તમારા બધાનો ખૂબ ખૂબ આભાર, તમે મને સમય આપ્યો. Thank you everyone, and back to Prafulaben. Thank you. So you just stop share.
Thank you, Anuja. A brilliant presentation there, and a journey through our pain, aches and pains, our daily pains, particularly caused by arthritis, osteoarthritis, and other conditions. Jem Tushabaya beginning mako ke koi પણ નહીં હોય કે જેને કોઈ ક્યારેક આવું કાંઈ આ પેઇન નહીં થયું હોય, અને એ પેઇનના ઘણા બધા રીઝન્સ પણ હોય છે જે આપણે અનુજાએ સરસ રીતે સમજાવ્યું. અને અલોંગસાઇડ ધેટ એનું શું થઈ શકે, એ ડોક્ટર રિફર કરે તો તમને ક્યાં રિફર કરે, ક્યાં તમે મદદ લઈ શકો છો અને શું અપ્રોપ્રિએટ છે, સાથે સાથે કઈ મેડિકેશન્સ અપ્રોપ્રિએટ છે, બધું જ એમને ખૂબ જ સિમ્પલી આપણે સમજાવ્યું. ઘણા બધા પ્રશ્નો ઓલરેડી આવી ગયા છે, એન્ડ તમે પ્લીઝ લખતા રહેજો. આપણાથી જેટલા આન્સર થશે આપણે પછી આ સેશન પત્યા પછી કરશું. So our next speaker is Menka Patel, and Menka was actually with us last session. We unfortunately had a little technical hitch with her internet connection, but a lot of you found her presentation very, very helpful. I had a lot of requests from people asking if Menka would do a demonstration of some of the common exercises to help muscle strengthen muscles, and some other, exercises that will help particular conditions. Menka is a very well-known face across Brent because she's part of the community physio service, a senior physiotherapist, and is going to share some important information with us today, but also then do a demonstration of some of the exercises. Welcome back, Menka, and let's hand over to you now. Thank you.
Thanks, Professor. Thanks, everybody. Namaste, and let's begin. So just going to share. So one moment. Right, so right into it, physiotherapy. Apologies about my slides from last time. So I'm just going to touch back about me and physiotherapy and some of the areas where you'd find physio. And then I want to hopefully look at a bit about pain, what a physio would do to assess this, some of the rehabilitation tips, a little bit about pain management. We've heard already about osteoarthritis, a little bit more about it, and how you can help yourself. Some of the NHS advice, a little bit about strengthening, and the all-important motivation at the end. So I am a specialist physiotherapist, and I currently work in the Brent community, and I see patients in their homes, either because they're housebound or can't get to the hospital easily, anyone over the age of 18, and I have over 15 years of experience. So what is physiotherapy? Well, it's the third largest health profession after doctors and nurses. It's a science-based profession, and it's a goal-orientated approach. And we basically look to restore movement and function that is lost due to injury, illness, or disability. Our main tools consist of exercise prescription, manual therapy, and of course, education and advice. And at our core, it's awareness, empowerment, and participation of our patient. We take a very much a whole person approach to increase and improve your health and well-being. Where do you find physios? Everywhere. But generally, our core areas are orthopedics, which we talked about last time. Respiratory, there's obviously been a lot in the news with COVID in ITU and some of the sort of respiratory wards. Neurology, so if you've got a long-term condition like Parkinson's, or perhaps you've had a stroke, you see a physiotherapist there to look at your quality of life and build you up and rehab you there. Elderly care, so any of the conditions that are related to age-associated relations, we'd be seeing you there. Musculoskeletal, which is kind of everything we're talking about today as well. It would include osteoarthritis, but if you've got like back pain. And then you've got specialist areas with community, pediatrics, women's health, and many more. So moving on to what we're here today about, what is pain? Well, generally, pain is an unpleasant physical sensation. We tend to characterize this into acute and chronic. Acute pain being a short-term pain that tends to alleviate itself within 3 months. And it tends to be acting as an alarm, telling us that something's wrong. And we mustn't ignore it because it can prevent further injury. Chronic pain is something that lasts a bit longer, and it tends to be present beyond the time that's normally required for soft tissue to heal. It's important to remember that it can affect any body part and in any age group as well. When this chronic pain becomes persistent, it can be linked to long-term conditions like osteoarthritis. It can be really annoying and devastating, affecting how we function in our day-to-day life. And it can really impact our ability to work, our employment, our sleeping patterns, and even our relationships with our family, friends, and general social interaction. The causes of chronic pain aren't always very clear. It's important to know, though, that the nerves network that are associated with chronic pain are also linked to parts of the brain that are concerned with emotions. So pain can affect emotions, and emotions can affect pain. So, for example, if you're feeling angry, depressed, or anxious, that can possibly make your pain feel worse. But if you're happy, feeling positive, that can make your pain experience a little bit less, and it can often help you cope better with it. So it's important to know that it's not just about pain in the mind or pain in the body. It's a real complex mix affecting our whole being. So physiotherapy. Now, with our assessment of you, if you've come to us with a ache and pain issue, we'd be asking a lot of questions. So we start off with a subjective assessment. And we'd be asking you all your general questions, what you've come with, what's your main problems. And we'd very much focus about your pain history. A lot of questions about the type of pain you have. We'll start off perhaps with the location. Where is it? Where is it radiating to, perhaps, if it's moving along, the distribution of it. The type of pain we'd really focus on. So the questions you might get asked are, can you describe it? Is it a burning pain? Do you have pins and needles? Is it more of a dull pain, an achy pain? Is it constant? Is it intermittent? Does it come and go? Is there anything that helps it? Anything that aggravates it? And we were looking at the behavior of this pain. So over a 24-hour period, how does this pain act? And this assessment can really help us depict the type of pain where it might be coming from. For example, pins and needles might tell us it's more of a neuro pain, or it might be that you are telling us it's achy and it's a joint pain or a muscular pain. So it will really help sort of negotiate our way through our assessment. We'd of course look to movement. So if it's affecting your, for example, if it's your lower limbs, does it affect your walking, your movement in your legs? So we'd, during the assessment, be looking to assess you and actually move you into those pain areas. So you might feel a little bit sore after our sessions, but you will be taught how to manage that as well. So we'd look at your range of movement. How much can you move? Where is it difficult? Where is it starting to hurt? How much strength have you got in that area? We'll be looking at also your transfers. So transfers meaning positional changes. If you're lying down and you try and stand up, is that manageable? Is that difficult? Perhaps stairs is difficult. That's another transfer. Or maybe standing from sitting down. We'd look at all of that, see where you're finding difficulties and see where we can help. If it is about looking at more your sensory areas, so looking at your muscle tone, whether there's any sensation that's been altered. And again, that might lead to other questions about what other conditions you might have. We might look a bit more at your gait. So you're walking. How do you walk? Is that being affected? Are you perhaps walking with a limp? We take a closer look at where your feet are. We talked last time a bit about base of support. Do you stand with your feet too close together? How's your balance? Are you at risk of falls? And we look at your walking aids if you have any. And if you don't have any, do you need some? So we'll have a full look at all of that. Also, we talked about the falls. We'd be asking those questions. If you are sort of showing signs where you're not as balanced, not as stable as perhaps you could be, have you had any falls? Are you at risk of falling? And how can we prevent those falls? So it's trying to make you as safe and independent from now, and then looking to build you up and get you better. We'll be looking at other areas as well, like your social history. So are you working? Is it affecting your work? Is it affecting your hobbies? Is there anything you really enjoy doing that you can't do? How's it affecting your family life? Because obviously if that's getting you down, the stress of it, that can obviously impact your pain as well. And of course, we'll be looking at how you're managing that pain. That might be via medication, and depend on what's worked, what hasn't worked, what have you tried, we'd make recommendations there as well. So it would be very much perhaps liaising with the GP or other health professionals to sort of negotiate a really good plan for you. We'll be talking about perhaps any conditions that you've had diagnosis over, educating you perhaps if there's anything that you don't understand, or perhaps advising you and talking together, working together to make a formalized treatment plan. Of course, exercise will feature in this, but it's also about your expectations, making them smart, so making them specific, measurable, achievable, realistic, and timed. So what are we looking at? But assessment-wise, we're trying to find the root cause of this pain and seeing how we can make it better for you. So moving on to what we could offer. So we've seen this table before, hopefully, but it is about looking at the tool set that physio can offer. So of course, exercise. This will help improve mobility and joint range. That will enable us to strengthen the muscles that will support your bones and your joints. We might use TheraBands or putty to help us do this. We will progress this individually at your rate to help you reach your full potential. It might be that the pain is still unbearable, it's still difficult, and we might discuss hydrotherapy. There's a lot of research that's proved it very helpful for arthritis, actually. So that would be something that would be a possibility. And also other areas we might look at is manual therapy, or perhaps taping. Taping can be really useful if there's misalignment in joints or muscles through just bad habits that have been picked up over the time. It can really help kind of ease the pain if we can move you into a different range, and we can then look at those exercises to build up that area as well. If pain is still affecting you, we might take other help, maybe electrotherapy, we've heard about TENS, or maybe acupuncture, just to complement us, to help us try and get you doing those exercises to strengthen you and look at how we can manage more long term. So pain management, we've heard about heat and cold therapy and how this can really help. And when you use them can also differ where we'd advise it. So cold, for example, ice therapy, we'd perhaps use more in acute phases. So when there's an injury that perhaps is inflamed, and there's redness, there's heat, there's swelling, it might be advisable then. That can also happen in chronic situations where there's flare-ups as well. Heat therapy might be useful more so when you've got stiffness, maybe some muscle tension, and it can really aid that area as well, and tends to be used more for the chronic side of signs and symptoms. And there's of course additional treatment options, mentioned the TENS. Medication is very much an adjunct. You don't want to be solely dependent on that. And I have found in my experience that people are either fully dependent and just all about the medication, or the other side of it, where they just want to live with the pain, they don't believe in the medication, they just don't want to take pills. And sometimes I think it's really kind of coming on board to say, okay, well, I'll take a little bit, but know that it's short term, just to help you do those exercises pain-free. So sometimes it might be setting up a program with the GP to say to a patient, we're going to try this, might be something mild like paracetamol, where you take it 30 minutes before our session starts, so you're fully ready, and I can push you a little bit more during that session and see what you can really do, and really start building up those exercises. And as you get stronger, as your joints are more supported, you can slowly come down from that and grade you down. So we can definitely devise a plan for that. It might be that the walking aid you're using isn't supporting you enough. What we don't want is you to get higher risk of falls. So if your pain is in your knee and your walking is becoming harder, it might be that you do need something in the interim while we build you up. So we might provide you with a walking aid. We might also refer you to occupational therapy or orthotics to help you. We've heard about OT, so I won't talk about it, but it's really a useful adjunct to help. So it might be a rail here or there, it might really help support you in your day-to-day life and make things a lot easier. Talking about education of the condition, if you understand what's going on and how it's moving forward and what to expect, it can really help you deal with it better. Pain perception, sometimes the behavior of pain. can really change you. So I found people not necessarily in the pain, but their behavior changes because they're expecting that pain. They're worried about that pain coming on. So they stop themselves from doing things. They won't go outside. They won't walk outside just in case that pain comes up, which is unbearable. So trying to balance that with activity, real hurdle, but it can be done. So it's something about education and advice and working through that. We're trying to reduce the impact of pain on the quality of life, because it's horrible to be stuck inside when you can actually get outside. And sometimes just being able to sort of manage that anxiety, manage that expectation with maybe some meditation, maybe some relaxation techniques like breathing exercises. And if you're still struggling, it might be a recommendation to get a referral to pain management clinic, where there's specialists to deal with more of the different sides. And we've talked about that. Well, Dr. Anuja just talked about that today as well. So we might be talking to a GP about getting referred there. So here are some of the walking aids that possibly a therapist might provide you with. So it would be very much based on your abilities and where we feel you are safe. And we'd be looking at your height and your weight and then providing you accordingly. And exercises, of course, we'd be looking at providing you with a tailored exercise program. And I wanted to really mention here that it doesn't have to be where you're in the pain. It might be that if you are in your easing factor is very much when you're lying down, you don't feel the pain, we can start the exercises in that position and then slowly build up. It might be that you're worried about walking around because that brings on the pain. We can start with some chair-based exercises and sitting. So we can move it slowly and grade it to wherever we need to go. I want to talk a little about stairs today. So stairs can be really difficult, especially if you've got things like osteoarthritis in your weight-bearing bones, so your hips and your knees. It can become really difficult, and actually just having to face the stairs can be really bring on the anxiety. So physios like to use an analogy. We like to say, good leg up to heaven, bad leg down to hell. You won't forget it once you've heard it. And the idea is that when you're going up the stairs, you start on your good leg. And it's important to remember to follow the other guidelines, which is basically make sure your whole foot is on the step, don't have any of it hanging off, making sure you're keeping that nice wide stance, so feet apart, shoulder width apart, and doing one step at a time. So lead with your good leg going up, and then when you're coming down, you lead with your bad leg. So good leg up to heaven, bad leg down to hell. And it might be that that's still difficult. So if you need a rail put in, good old OTs will come to your rescue. And it might be that we teach you with an aid. So it might be that you still need a bit more support. So we might show you with a walking stick. So a therapist would go through with you and practice that until you're confident. We've talked a lot about arthritis today, and I just wanted to focus on it because it is really important. And just focus on that, it's approximately 8.5 million people that have painful joints due to osteoarthritis. There's about 70% of people with OA that report depression when pain is at its worst. And that's going back to that whole association with how you're feeling and pain and relating it. And we know that exercises can help with your mood, and it can definitely help with OA. So staying active is really effective in managing that. And focusing again, we've heard tonight about normal weight. Studies have shown that compared to someone of a normal weight, an obese person is 14 times more likely to develop knee arthritis. So maintaining a healthy weight is really effective. And just to highlight, you don't have to have arthritis to keep that normal weight. Prevention is better than cure. So start now, try and get in for that normal weight and keep it there. So where might you find arthritis? We've heard today again that you do find it everywhere. So your low weight-bearing bones, your hips, your knees, your feet. You might find that when you're walking, you feel that stiffness, that pain come on. It might be when you're managing the stairs. It might be when you're trying to bend and you're trying to pick something up off the floor, or perhaps when you're lifting something and you feel it in your lower back. It can also affect your upper arms, so your shoulders, your elbows. You might notice this when you're actually trying to get dressed. Perhaps you're combing your hair and you find it really pain on your shoulder. Or you might find that trying to straighten your elbow to put a sleeve in is difficult. All these areas could indicate arthritis. Hands are another one that people talk about. So I find people opening jars, for example, find it really difficult, or trying to do pincer movements of small things, and they find that they're very stiff, their fingers are painful and quite swollen. So what can you do? How can you help yourself? Well, there is things you can do. Exercise, of course, has to feature in that. And that's because it increases your endorphins, your happy hormones, which act as a natural painkiller. This helps relieve some of the stiffness in your muscles and joints. And it will, of course, help you reduce your weight gain and maintain your healthy weight. And of course, the falls that we've talked about, improving your balance and minimizing that risk of falls, exercise can definitely help you with that. With chronic pain, it can still get you down. You might feel that low mood and that anxiety just isn't helping. Support groups out there, such as talking therapies, and I know that there's some here in Brent and Harrow, can really be helpful. It might help to speak to a counsellor, a psychologist perhaps, to talk about how to cope with those things. CBT we've talked about today as well. The good thing about talking therapies is you can self-refer. You don't even need to go to a GP for that. You can self-refer and get that started. And of course, there's no underestimating a good night's sleep. Try and create a good nighttime routine, whether that's doing a few stretches, some relaxation music. Try and go to bed at the same time each evening, and in the morning, try and get up at the same time as well. And just get a good routine of that. Avoid trying to take naps during the day if you can. And relaxation techniques can help you with that if it's a problem. They also help reduce chronic pain and what you feel and muscle tension. And this also improves, of course, with broken sleep patterns. And they can be very simple: breathing exercises, meditation, mindfulness. And distraction and activities that takes focus away from the pain can be really helpful. And hobbies can be done even if you've got reduced mobility. It doesn't have to be extreme. It's just sewing or knitting, photography, reading, anything that's a distraction away from that pain and helping you not think about it. And friends and family, of course. Keeping in touch is really good for your well-being. Perhaps phone a friend or invite someone home. Keeping to the rules, of course. And aim to avoid talking about anything but your pain. Have other areas of focus, and that can really help as well. So do you have any of the conditions mentioned today? Are you suffering from aches and pains? Are you worried about falling? Doing exercises to improve your strength, motion, and balance can really help you feel better and definitely more confident. The NHS advises to spend less time sitting or lying down and break up those long periods of not moving with some activity, daily physical activity. Activities that improve strength, balance, and flexibility at least twice a week. That's at least 150 minutes of moderate intensity or 75 minutes of vigorous activity. And if you're already quite active, a combination of both per week. But what is moderate and what is vigorous? Well, first of all, light is moving and not sitting or lying down. So perhaps making a cup of tea, just moving around your home, a bit of cleaning, a bit of dusting. But moderate exercise or activity type is increased heart rate. You're faster breathing, you're feeling a little bit warm. A good indicator is you can talk but not sing. So a bit of brisk walking, perhaps a bit of light gardening. Vigorous is when you really feel it, hard and fast breathing. You can't really say more than a few words without pausing. So jogging or energetic dancing are really good examples. And there's many more. And strength exercises are really good at making you feel better, stabilizing you, improving your balance, and increasing the amount you can do. So you can do this at home or in a gym, wherever you like to do it. And it can start with simple things like Tai Chi, perhaps, heavy gardening, lifting weights, or perhaps you prefer yoga or Pilates. There's many things you can do to help yourself. You just got to see what suits you. And just touching on orthopedics, it can be that actually it's not been helpful and actually you just need that referral to orthopedics, which is something that you speak to your GP about and have that referral done. But it's still important, as it's been said tonight, that even with surgery pending, it's important for you to keep doing your exercises because you want to strengthen those muscles as much as you can and maintain your movement before that surgery. You might be having it on your right knee, but you want to make that left knee just stronger than it can be because you know that you're going to be putting more weight onto that. It might be that you might be already know that you're going to be non-weight bearing on one leg. So get your arms nice and strong so that you can mobilize a bit more freely. And also after surgery, be ready to do those exercises. So just a reminder. With chronic pain, it's not easy. Time can really take its toll on you, can affect your mood. But it's really important to have a starting point and set realistic short-term goals. It really will be worth it in the long run. And build exercise around your daily activities. So it might be you love your Star Plus cereals. They have so many adverts. If you just do one exercise on each advert, you will be absolutely fine. You'll get loads done. Or it might be when the kettle's boiling. Don't just stand there. Do a few mini squats. build it up slowly and incorporate it into your day-to-day life. And start where it feels comfortable. You should not be in pain, and you shouldn't be going into pain when you're doing your exercises. Start with just a simple routine and then build on it. And don't progress until you're ready to something more challenging. If that doesn't really suit you, perhaps a chart, something that's a bit more visual. You can write down in a very simple way things that you'd like to do, and you have a daily target that you're trying to achieve. And then note down every day what you're doing. It might be a weekly target. Just see yourself improve day by day and visualize your progress. If you're living in a mixed household, do it together. Add some nice Bollywood music if you like. Have a little jiggle. It really helps to do it together. And also help each other by not helping. Traditional setups where you tend to do everything for the elders leads to less active elders. So encourage each other, monitor your progress, and be motivated by the change. Make it a lifestyle change. I hope that's been helpful, but I'm not completely finished yet. But I'm going to just be over. Oh, and some references for you as well. I'm going to hopefully show you some examples now. I'm going to stop sharing now. So I'm just going to move myself.
So Menka Ben, that was amazing. So much information. And now we're going to see a short exercise demonstration.
Great. So today I wanted to show you about therabands. I've mentioned that today. So this is potentially one of the ways that we would try and help build your strength. So here you can see there's an assortment of colors. So yellow, just want to show you, is actually quite easy. You can see that's quite flexible. And then we would move to red when you're ready. So you've got red there. And again, that's still not too bad, but I can feel the resistance. Then it would be green and then blue and black. So if I just show you black, and I'll try and pull it, it's actually really quite tough. So these are the ways that we would build it up from the start. So just to show you something simple. So I get a lot of patients who say they're not really doing exercises. They're stuck in the chair most of the day because they don't feel safe, perhaps mobilizing. How can you strengthen? There are ways. So I'm going to show you some simple exercises that sometimes I give some of my patients to build up their lower limb strength. One of the things that I suggest is you get that, and you want to apply some resistance. So you go over your knee and you hold it against the chair. You then go against the band. So you lift up and you hold. It might be that you start with something very simple where you just lift up slightly. You feel that resistance, you hold it for a few minutes and you come down. And as you get better at it, as you get stronger and you can manage the pain, you can go further and hold for longer. And then you can move along to the next band. But I'd probably build up your repetitions and your sets first before I would do that. Everyone's different, everyone works differently. So it would be very much tailor-made for each individual person. Another exercise is bringing your foot up, holding it. And if I was doing arm exercises, I could do that, but it's not, it's lower limb. So my arms stay still. I push down, again, hold, and bring back up, push down, hold for a few minutes. So that again is building up some of the muscles in my legs. Another one is where I tie the band around my knees. My feet slightly apart. And again, I would then pull apart. Feel that resistance and then hold it and then back again. And that might look easy, but if you do it 10 times, I promise you, it will feel achy after that. So just a few of those, and you can build up the holes and build up how many you're doing. I could even move that further down, extend my legs and do it there as well. So there's different ways of managing with that. If we're looking at your upper body, there are ways to also use this for your upper body. So for example, shoulder exercises that I would possibly give. I call it the star. So you go across and hold, and you just draw out a star, across and hold, crossways, the opposite way, and then of course up and down. And don't forget to swap. So that was a really quick demonstration, but it just gives you an idea of the different things you can do with some bands, and you can see how that progression would go on. And I'm sitting in a chair, I don't have to get up, my Star Plus is going on. There's no excuse really. So you get to get doing those exercises. We talked a little bit about putty and hand therapy last time. And I just wanted to show you some putty and what it looks like. So I've got a green one and a red one here. And again, they come in different strengths. So the green one is actually a bit more harder, so I'm not going to use that. So I've got the red one, which is starting to melt in this heat. So for example, you can see that it looks a bit like if you've seen children's Play-Doh, it's a bit like that, but not quite. It's actually quite tough. You can see that. So what I'd start by doing is just simply just moving it in your hands, and you can already see how it can really start making your hands work. And you can see those muscles working as you're pushing down. And there's quite a resistance felt there. I'd start with that, and then I might say, right, pull it. And I talked about making a bracelet last time. So you do that one, and you do that, and then you push your fingers out, and that's the resistance that you feel. And if you've got weakness in your hands, you'd really feel that, and you'd build it up. You might then make it more individual. So you might try and do it per 2 fingers, and then pull those away. And again, you're building up resistance there. And then you might twist, so start involving everything. And then it might be one at a time. So you can break this off as well. I mean, there's so many exercises, it's so never ending. So you can put it in the palm of your hand and take 1 finger at a time to press in. And you can really feel that. Or it might be squeezing between the fingers. That's another one. So we take a little bit. And you put them in between the fingers, and then you squeeze. And you've got to try and do it without touching it. It's actually quite hard. And this can really build up the hands and the muscles between them. So there is always an exercise out there for you. It's just sticking with it and really giving yourself the chance to go, because sometimes it can take a while, especially with chronic pain, but it will be worth it in the end. I really hope that's been a bit helpful for everyone. Okay, thanks very much. Back over to you, Profula.
Thank you so much, Menka. We have learned so much today in terms of, the referral to the physio and why, and how physios can help us. પહેલા આપણે Dr Anujaએ ઘણી બધી વાતો સમજાવી છે. આપણે GP પાસે જાય તો એને શું કહેવાનું, GP ને કેટલી ઇન્ફોર્મેશન આપવાની, એનાથી GPs ડિસાઇડ કરી શકે કે આ પેઇન કદાચ ક્યાં એનું મૂળ છે, એનું રૂટ છે. અને પછી તમને એ જાણ્યા પછી તમને રિફર કરી શકે. સો હવે આપણે આપણા બધા સવાલોના જવાબ આપણા પેનલ પાસે માગશું. અને એટલા બધા questions આવ્યા છે, so I'm not sure કે આપણે બધા આન્સર કરી શકશું, but we're going to have a go. અને આજે સવાલો પૂછવાના છે myself and તુષારભાઈ, અને આપણો panel is the 2 speakers you've already heard. So Dr Anuja and Menka. So આજે એટલા બધા questions છે, ઘણી બધી જુદી જુદી સમસ્યાની વાતો અહીંયા થઈ છે. Just one thing મારે બધાને જરા clarify કરવું છે કે અમે કોઈના individual કોઈ પણ conditionની વાત અહીંયા નહીં કરી શકીએ. અને obviously એ તમારા GP પાસે જઈને એમની સાથે consultation કરીને એ તમને મદદ કરી શકે. But in general જે વાતો છે એ questions આપણે લઈ શકશું. 2 very important things that have come out of today's discussion and talk is the importance of exercise, the importance of weight and weight management, and આ બધા conditions માટે એક theme almost developed થઈ છે. In every single session, almost we have talked about the importance of weight management and exercise. So બહુ જ આપણા બધા માટે important છે, and we should, after hearing what we have heard over the last 7-8 sessions, definitely I hope very many more people will be doing exercise. So Tusharbai, shall we get going with the questions? I'm going to pass to you to do the first one, and then we'll go in rotation.
Okay, so before I touch on the questions, thank you, Profula Ben, Dr. Anuja, and Menka Patel. Thank you very much. Excellent presentation from both of you, and I think the questions themselves, is just shocking. You know, we are just overwhelmed. Yeah. Just to let you know, questions key websites Cube Cream Vaporo, etc. that was mentioned. So just to make members aware, our video will be available to be seen on our YouTube channel and Facebook page. So you can actually start the video again, stop it there if you want. Information Menka Patel actually it's not coming out easily. I refer to as Menka Ben, but I've been told off, so Menka. But just natural instinct. Unfortunately, yeah. So if I say it, apologies. Yeah. So of course, Menka Patel came out with many slides about exercises, etc. Yeah. So you can refer to all those slides again in your own time on YouTube, as well as the Facebook pages that we've now got. Yeah. One other thing that Ji Vatchit kari thi is also important, and both of the professionals touched on it. Yeah. Exercise. मतलब घणी વાર શું થાય દુખાવ થાય ને આપણે બધા શું કરીએ મને દુખાવ થાય છે મારે કઈ કરવું નથી મારે બેસવું છે એક જગ્યાએ. And that's the worst thing that anybody can do. થોડું exercise કરવા જોઈએ. Yeah. And secondly is obviously જેટલું થાય એટલું કરવાનું, and but also Menka touched on it, is keeping your mind occupied. તમને મારો example દઉં, તમને મારો હાથ દેખાય છે અહીંયા. I fractured my wrist. Yeah. દિવસના ટાઈમે I don't even know I'm wearing this. પણ હું ઘરે આવી સાંજે બેસીસ છાનો માનો ટીવી જોવા કે બીજું કંઈ કરવા બેઠા ત્યારે I feel the aches and pains here because my mind is not occupied. દિવસના ટાઈમે when I'm working, I don't even know I have this bandage on, this Velcro support on. Yeah. So keeping your mind occupied is very important. And thirdly is obviously કે આપણે exercise ને કરીએ. Sometimes આપણે એકલા હોય, it is difficult. It is difficult. Motivate yourself to do it.
Definitely is. Yeah.
So wherever possible, jo exercise if you do it in groups, whether you go to a local yoga session, one secular centers ne thai jase khula, ke local community center, wherever you live, doesn't matter. And a local group mane join thai jase. Watching other people, doing it with other people, it motivational itself. Yeah. So try and join that rather than doing it. Yes, ghare to karvanu che thodu ghanu. But to get that extra to get to the next level, always when you do it with a group of people, will motivate you.
Yeah, and I think Tushar Bhai, for the younger generation, there's a role for them to play here to encourage the elders, find out the information for them. Locally, classes hoit, you can find out the information for the elders, maybe even take them for the first few. And it's so obviously our Brown Center School we have got a range of those kinds of classes going on. But in the meantime, local councils, local leisure centers are bada paase our classes to hoiche, So some are very subsidized, others you do pay for. Some may even be free. Ganana Gujarati speaking instructors pan hoiche. So I think really important check apre elders the community ne thorok apre youngsters pan support ape awat ma, and then to make them get better much faster. One other thing, Tushar, I was going to refer to Menka. You mentioned the incidence of falls, and once somebody has fallen once, it really affects them in so many ways, psychologically as well, because ek dar besi jay, ek fere pade ne. એટલે પછી બહુ જ difficult છે લોકો માટે once they've fallen to get better. So for them it's even more important, I think, થોડુંક helping hand લોકોને મળે, થોડુંક motivation મળે, and then it really helps. Right, Tushar Bhai, go. Your first question. We've got so many questions.
I know, so I will more, many are duplicates, so we're not going to touch on the same subject again, but something that's different. Okay. Somebody is asking us, why are physiotherapists so reluctant to manipulate the spine? As it helps to alleviate the pain, but the therapists are very keen to give the print. As you know, one cannot do it myself. What can one do? So I think Menka Patel is probably the most suitable to answer on that question. Yeah. Why are they reluctant to manipulate the spine?
So obviously I don't know what's wrong with the spine, so I don't know why they have perhaps manipulated first and stopped. But I think if I can be general in that, with physiotherapy, we're looking at long-term effects. So if you're saying that manipulating it is giving you a short-term relief, great, but obviously you can't keep doing that. You've got to look at the long-term benefits of that. It might be that the muscles and structures around that area of the spine might be weak or might have misalignment issues. You might want to focus on strengthening your back. If you're finding that pain is a barrier, it might be looking at some of the adjuncts I talked about. Maybe a TENS machine would help you. It might be hydrotherapy, it'd be a great one. And hydrotherapy classes tend to be bunched up in groups. So you can get spinal ones, you can get lower limb ones. So perhaps a spinal hydrotherapy class would be really beneficial, especially if you're finding that it's difficult to move in that range and you're not able to sort of do your lying down exercises, perhaps, which is where I'd probably start you. But you want to look at more long term. And so with the physio, I think that's probably the best answer I can give. The spine actually is it's an area where, you know, you need to really be looking at, you've got so many nerves going through there. There's so many different things that you need to be careful of. You need to know exactly what the cause is that's causing the pain. So yeah, I hope that helps.
Great. So the next two questions are actually kind of quite similar, talking about arthritis. It says, does yoga exercise help arthritis? And the other one is, can you manage osteoarthritis without an operation? So it's kind of, I think they're two linked really. So I'm going to stay with you, I think, Menka, for that one.
Absolutely. Yoga is really great. It helps build the core. It helps doing very sort of gentle exercises that can obviously become tougher. And absolutely, any form of exercise, any form of activity is going to help. So for both those questions, yes, yoga can help. And yes, arthritis doesn't have to end with a surgery. You can really control it. You know, we've talked a lot about it. It might be worthwhile going back over the slides from tonight and looking at some of the benefits you can do to help, first of all, maintain that healthy weight and include exercise as part of your day-to-day. So lifestyle changes.
Thank you. Great.
Okay, so there's a question here for Dr. Anuja. Yeah, medical question. If the synovial fluid between the thigh bone and the shin bone, why does it decrease? And is this formed naturally in the body? And does any injections help?
So synovial fluid, yeah, thank you for the question. Synovial fluid is formed naturally in the body, and it's a fluid that's in the between the bones, as you say. And we know that sometimes in osteoarthritis, there can be slight decrease in this fluid. There is no evidence that actually injecting anything can help. The only thing that can help is sometimes injecting steroids. You know, so steroid injection in the joint can help with the pain, but that's only so that the person is able to do the exercises. You know, just as everything, exercise is actually the mainstay of treatment, and anything that we do is actually as an adjunct to the exercise. So it's not to be used standalone. It's there, the injection is there, so that you're able to then carry on, go and do your exercise. It really works very well. You know, the steroid injection works very well to get rid of the pain and allows you to do what you really need to do.
Thank you.
Great. So I'm going to stay with you, Anuja. Got a question here. It says, what happens when a person keeps on falling down repeatedly? So they come to a GP and that's their complaint, that, you know, they keep falling down repeatedly. What do you do? How do you manage that?
It's a great question, but actually it's a complex question as well, because we need to find out why the person is falling, and there's several reasons for it. Absolutely several reasons. You know, it could be your blood pressure is low. Maybe you've got vertigo. Maybe your muscles are not strong enough. Maybe you've got Parkinson's disease. So it really is a minefield, and we need to investigate why the person is falling. Sadly, the consequences of falling are really, the complications are really quite severe. So not only can you end up having a fracture, but also what can happen is you can have a fear of falling, and then that leads to further weakening of the muscles, and your world kind of gets smaller and smaller, because it prevents you from going out. You then become housebound, and slowly you're reluctant to go places. So it really is detrimental. And I think even after a couple of falls, you should go and see your GP to find out why the person is falling, and really it needs to be investigated. I can't give us one answer to this.
Yeah, so you'd kind of refer them and get more investigations done effectively.
Yeah.
Great. So I hope that's helped the person asking that question.
That's right. And medication review is very important as well, because these days people are on so many medication, and it's not unusual for people to be on as many as 10 medication. And often, they've been started many years ago for a completely different reason, which might not be valid today. So it's important to get rid of medication, to cut down on the medication burden, because there are lots of side effects with medication. They can reduce your blood pressure. They can actually
MRI done. That was normal, referred to a neurosurgeon. He could not find anything. And now they're suggesting a physiotherapist may help. But before we go into that question, answer, Dr. Anuja, I'm a pharmacist, so you're all aware, or past practicing pharmacist. Now, headaches, but the advice that we always give is, yes, you take your paracetamol, but also sometimes a simple diagnosis, what sets of the headache, sometimes just simple notes on that, what were you doing before you had the headache? TV or looking at bright light or going out in the sunlight without the sunglasses on. Yeah, you've not had enough sleep or not drank enough water during the daytime. Things like this can settle the headaches. So sometimes the simple diagnosis by the patient itself helps. Yeah. So coming back to this person's questions, constant headache here, they've had an MRI done, neurosurgeon. So what is the next step for a person like this now? Dr. Anuja.
Yeah, I think you touched on a very important point, Tushar Bhai, that there can be several reasons. And often when someone comes to me with chronic headaches, the first thing I say is, can you keep a headache diary? And it's exactly all the things that you said, keep a diary. And often we see a pattern, that the headache has followed a certain event, or something that you've eaten. So it's very important to keep that headache diary. Often, simple analgesics will help, as you say, paracetamol, ibuprofen sometimes can help. But some people take these all the time. And if you've been taking, paracetamol and ibuprofen, or even codeine for as many as 10 to 15 days in a month, that can actually give you a headache. So we need to think about, what is actually causing the headache? Is it the treatment that we're using which is actually giving us a headache? So, we need to think about all these things. Obviously, go and see your optician, just to make sure that your vision has not been deteriorated. And after all these things, this person has obviously already had an MRI scan, and I'm assuming that all of these basic things were already done. And after all that, I think sometimes, yes, a referral to physiotherapist, because it could be tension headaches, it could be muscle tension, which comes from the back of the neck, comes all over the head, and just having some simple physiotherapy of the head and neck can help. And I don't know, Menka, if you want to throw some more light on that.
Yeah, absolutely. I completely agree with everything. It can paramount to have that diary to see what is causing it, because it can be food related, dehydration related, medication related, and also time of day, weather, so many things, everything you've touched on. And the physio will definitely look at all of that, and they'd obviously get hands on, have a feel. Is there a lot of tension or stiffness? Is there any alignment issues? And we'd of course, give an exercise program, and we'll be aiming to sort of mobilize the neck and as well as start strengthening some of the muscles. And from personal experience, this does actually help. I suffer from headaches, and actually I found such a huge difference just by hydrating myself better. And I do regular head and neck exercises, and it's made a huge difference. So yes, definitely exercise.
Coming back to exercise then.
Always.
So I've got a question here from somebody who says they've had knee pain for 16 years and in the last couple of years has developed Achilles tendonitis. What can they do to help themselves and, alleviate this constant ache and pain? So I don't know if Menka, maybe you want to take that one, and then if there's any specific medications, maybe Anuja, you might jump in and talk about that.
So it almost sounds like she or he has had this pain in the knee, and then obviously because of perhaps different alignment issues or muscle wasting, that they've now got a problem in that same leg into the heel. So it's almost like it's coming because of that, so secondary to that. So I would be inclined to perhaps look at just gait analysis as well, what's actually caused this tendonitis as well. But if it's an acute problem, if it's something that's flaring up very actively, going back to sort of things we've mentioned about ice, if it's quite swollen and red. With tendonitis, ultrasound therapy can be helpful sometimes. It's got mixed reviews in terms of research, but it's worth a go if she's not tried it or he's not tried it. TENS can also be another one, depending on how acute or chronic the tendonitis is. And exercise, stretching it, because sometimes they can go into spasms as well. So if it's not being stretched and then all of a sudden you're trying to walk on it, you can actually aggravate it. So if they've not seen a physio for the tendonitis, it would be worthwhile getting that referral and having somebody take a closer look at it. And again, going back to the hydrotherapy, if it's really painful, it's just not moving forward, you're looking at those adjuncts that can help manage that pain so you can move forward with the exercises. I think that's it.
Great. Anuja, do you want to add anything to that?
Yeah, and sadly, it is more common in people who are overweight. So try and lose weight. It always boils down to that, doesn't it? Try and lose weight. And sometimes cold compress does help as well. Just applying ice or putting a bottle half filled with water, plastic bottle half filled with water in the freezer so that it freezes up, and then just rolling it on your feet. So that seems to help as well. It's particularly worse in the mornings.
Great. Just going to weave in another question there. Sorry, Tushabhai, really quickly. The hydrotherapy that you mentioned, Menka, several people are asking, how do we access it? Where is it? Where do we access it?
So it depends where you live. Here, so I work in Brent, so Norfolk Park have a pool, and in Stanmore, the Royal Orthopaedic have a pool as well. You can get a referral physiotherapist, actually, if you've got one. They can refer you into it, and also your GP.
Okay, brilliant. Thank you. Tushabhai.
Okay, there's a question here. Sorry, I missed it. The metatarsal is hurting. What can I do to alleviate the pain? Dr. Anuja.
Metatarsal pain, there can be, again, several reasons. There's something called Morton's neuroma, which can cause a pain, and sometimes that may need surgery. It really depends on what the cause is. It's very difficult to generalize it, but looking at footwear and having insoles would definitely help as well. So this is somewhere somewhere that you can actually look at really good insoles, which will take some of the pressure from your metatarsals. And just for clarification, metatarsal are the bones in the feet.
Thank you.
So there's several questions about cramp and needles and pins. So talking about cramp in both thighs, needles and pins in the hands and legs. What could be the cause of this? I'm not sure who wants to take that question about needles and pins.
I can start. Sorry. Shall I start?
Yeah.
So again, there can be several causes for pins and needles. So pins and needles of the hand, carpal tunnel syndrome can be, quite common. It is very common. It's common in pregnancy, common in people who may have low thyroid levels. Again, diabetes, can also make you more prone. Diabetes can also cause pins and needles and numbness of the legs. Vitamin B12 deficiency, folate deficiency, all these things can cause this. I think if it's persistent, then you must go and see your GP, and you must mention it so they can investigate, further. You may need a blood test, so it's important to go and see your GP.
Brilliant, thank you.
Okay, so the next question for both of you is, what is a robotic operation for knees? They've heard there is the latest operation on knees with osteoarthritis. So you can just briefly touch on that.
Yeah, I can start, and then Menka, if you want to add any more. Basically, robotic operation for the knee is exactly the same as a traditional knee surgery, except it's been done robotically. Literally, the surgeon can be sitting in the other room, and the patient is in the first room, and he'll be operating everything robotically. The benefit of this is that the incision is very small, and there's very little trauma to the muscles and the bones, and the recovery is really fast. It's amazing. So, that's the way forward, and in fact, robotic surgery has been around for many years. But yeah, we're hearing more and more of robotic surgery, and it's really exciting.
Thank you. I think Dr. Proflaben, if you remember his name, he was on the last session. He talked about it briefly, yeah?
That. Yes.
That's it. Dr.
Yes, he did.
Yes,
he did talk about it. Yeah.
Okay. Your question.
Got a couple of questions here. One is about the gel that was mentioned. What was the name of it? And do you recommend steroid injections for osteoarthritis?
So the gel, in fact, ordinary ibuprofen gel, which is available over the counter, is useful for knee pain. So any joints that are fairly superficial, so the knees, the hands, it's not very useful for hips because it's a very deep joint, isn't it? So it might not be very useful. It's no harm trying, but might not be as useful for the hips. So it's ibuprofen gel, and the other cream that I mentioned was capsaicin cream, which is a chili pepper. Tushaba, you probably know more about it than I do.
And I think Gurudat did mention that last session as well. Yeah.
Useful. And steroid injection is helpful to help with the pain, so that you're able to carry on with exercise. And most surgeons or most physiotherapists would do it, but probably shouldn't be repeated too often, and should be used in conjunction with exercise, not on its own.
So just staying on that subject, there's a question here, says, in view of COVID and some of the advice we were all getting, is it okay to take ibuprofen?
Absolutely.
Great, thank you. That was quick snap answer, wonderful. Right, Tushar?
Okay, so to touch on that topic, and I'll put my pharmacist cap on again, always remember, to see Dr. Anuja, you'll have to make an appointment. To see Menka, and you'll need 2 to 3 days appointment, or whatever days, that's how busy the surgery is. Menka Patel, to see her may take you a couple of weeks, to see her, and refer through your GP, It doesn't happen just like that. But you've got the advice of a professional pharmacist right around the corner from wherever you live. Tamari dawa jahanti leta hoy, they will be advise you a lot of medications over the counter. Diclofenac gel share, ibuprofen gel share, Movalet gel share. They come in different strengths, sizes, etc. So always go and talk to you, because that pharmacist, you can see him within 10 minutes, very well knowledgeable people, and make the most use of them, in this pandemic time, especially in this pandemic times, So they have a lot of knowledge on this, Okay, so there's a question here. Where's it gone? Sorry. Do you want to take that one? I just lost my page here.
Yeah, so we've got so many questions still to answer, and we are almost out of time. So we're going to take a couple more, and then, you know, if there are still some left over, maybe we can bunch them up together. And at some point, we'll answer them and post them on the website or something. So the question I've got here is actually for you, Menka, and it's, you know, the stretch bands and the putty. Presumably that comes from the physio. So they're asking, where do we get it? So I'm assuming that you have to prescribe it.
I mean, you can buy it, but I wouldn't advise it because I don't, you know, the idea is to start you off at a baseline which is comfortable for you. So if that's something that you're keen to try, just get a physio referral. It may take a few weeks, but it'll be worth it. And they can set you up with a really nice program. They can even provide you with these things, so you don't need to go out and buy them. And I mean, I tend to just, with some patients that are really keen and motivated, I even give sort of progression exercises. So I'll give one set and I'll say, you know, when you can do these 3 times a day and you're doing, you know, 10 of each of these and you're doing it, I don't know, on the green band, you can move to this set of exercises and you can, you know, carry on and do this. So they know where they have to go. And once you've done that, we are a short-term service, but you can get re-referred if that's then too easy. So if it's for a specific injury or condition that you're trying to kind of overcome, there is that ability to sort of come and go to a physio. So don't think that once that door shut that you never can go back. You can.
Brilliant, thank you.
Okay, so I would like to also touch, and I'm sure Dr. Anuja will agree with me on this, is the medications. And this is something that we used to hear quite often, and especially APRI community. Yeah? To give an example, if you're taking ibuprofen, anti-inflammatory, that's 400 milligram tablets TDS, or 3 times a day, sorry. Yeah. And a paracetamol, you take 2 tablets 4 times a day. Yeah. So ibuprofen is 400 milligrams, the paracetamol 2 tablet loads 1000 milligrams. Am I not overdosing? 1000 milligrams loads or 400 milligram loads? Do not compare the strengths of different medications, first and foremost. Yeah, there is no correlation between them. Okay, 400 is half the strength of 1000 milligrams. Yeah, they work in a different manner, but Jitamaro recommended dose which the doctor has given you, stick to that. Of course, if you see the side effects, then go and see the GP, go and see the pharmacist. They'll be able to advise you. Yeah, but MDM stop nikanata and don't even take half the dosage. You know, ઘણી વાર હું સાંભળું મારા પોતાના ઘરમાં જ 2 લેવાની જરૂર છે, 1 લઈ લો તો ચાલશે. No. તમે 1 લેશો, you're taking a pediatric dose. છોકરાઓનો dose તમે લ્યો છો. Like paracetamol only works if you take 2-4 times a day. અને બીજું 2-4 times a day એટલે આપણે દિવસના જાગતા હોય 12 કલાક એટલે 12 કલાકને એ લોકો 8 ટેબ્લેટ લેશે. No. Try and આપણે દિવસમાં 24 કલાક છે. Yeah. So what you need to do is take it every 6 to 7 hours rather than every 4 hours, and then take nothing for the next 10 hours when you're asleep. Yeah. So try and spread your medication throughout that 24-hour period. So assuming the antibiotics they do it 3 times a day, don't take it 3 times in the daytime, take it 1 capsule tablet every 8 hours. So you split it in that 24-hour period, because what happens is the medication has to go into your bloodstream, maintain a certain level before it, beneficial effect male tamari body ma. And if you don't take it regular levels, tamari bloodstream ma ji medication hoy will drop automatically. Yeah, and pachi effect will not come. So try and split your medication according to the 24-hour period, not a 12-hour period when we are awake. Yeah. So I hope I've explained that amari pharmacy side mathi. Yeah.
Thank you, Tushaba. Yes, well explained. Right. So we really have time for 2 more, and that's it. I think we definitely have overrun today, but you know, I think it's been such an interesting session with so many questions. We had over 344 people joining us on YouTube today and also on Facebook Live. So I think lots of people are going to get some very useful information from this. And of course, you know, we get audiences going back to YouTube later to look at these sessions as well. So the question I have, Menka, it's going to be for you, I think, is what exercises are best for lower spine back osteoporosis?
So I wish I could show you. Lying down exercises, you're stabilizing the lower part of your spine. So basically you can bring your knees up and move your knees side to side. That can really mobilize it. Strengthening exercise. So, you know, sort of the core building exercises. Some of the Pilates exercises are really good for that because they're static exercises. So you're not necessarily moving the spine too much, but you're building up the muscles around it. It would be so much more beneficial to have an assessment done, find out specifically what areas need building up and have an exercise program built to that. So referral to physio, please.
Brilliant. Right. Dusharpa, I think this is going to be our last question today.
Okay. So where are the hydrotherapy classes?
I think we covered that one.
Did we cover that one? Sorry.
Yeah.
Yeah. Okay. So I think that's about covers everything now. One of the where I'd like to finish off on this, our time puro thai છે. આજે આપણી પાસે બે professionals they've given us so much information. ઘણું બધું જાણવા મળ્યું છે. An excellent presentation, slideshow બધું છે, like I explained before, બધું તમે પાછી જોઈ શકશો YouTube માં અને Facebook માં. Yeah. But what we also have to remember કે આજની in today's technology આપણા બધાની ઘરે we have a Dr. Anuja and we have a Menka Patel in our own homes every day, 24 hours, 7 days a week. Yeah. એ ડોક્ટરનું નામ શું છે? કોઈને ખબર છે? પ્રફુલ્લાબેન? એનું નામ છે Google અને YouTube.
Oh my God, you don't say that in front of a GP and a physio sitting here. Google.
No, what I'm saying is કે આજે ગમે ત્યારે આપણને ઇન્ફોર્મેશન જોતું હોય, it's truly unbelievable કે આજે touch of a button કે આપણને ઇન્ફોર્મેશન આપણા ફોનમાં, આપણા કમ્પ્યુટરમાં કેટલું બધું જાણવા મળે છે. This technology was not around 20-30 years ago. આજે ગમે તે ટોપિક આપણે રિસર્ચ કરવો હોય, Menka Ben showed us some exercises. Yeah. This is only a tip of an iceberg what she showed you. Yeah, there's probably 100 or thousands more of different exercises we can do.
Absolutely.
You just open up YouTube and look at so many different videos to make the most use of these doctors that apni ghare che 24/7. Yeah.
Yeah, but I think, sometimes Google ma badu join apre self-diagnosis pa na kari shake.
No. I'm just saying there are certain things.
In terms of exercise and exercise plans, the websites that Anuja mentioned earlier, they're all brilliant. The NHS website for those exercises, I've been using that daily actually since I've been working from home. That whole thing of sitting at your computer, not really taking breaks. So I've decided to put an alarm clock on my desk, and it makes me get up every hour. And so I do some stretches from those charts that they're showing. So I think those things are really important. And also screen time away from, your eyes away from the screen, which, we're going to talk about in our next session. But all those things are really important as well. So Menka, you're not going to believe I've got requests for you to come back and do some more demonstrations of exercises. So I tell you, this session has been so popular and so many people are writing saying what a great subject. So thank you, both of you. Brilliant. There's lots of information there. I think people have got some really good practical tips, some exercises they can do at home. Some things I think they'll cope with better when they go to their GP next time, because they'll be able to understand actually when a GP GP right? Because that's really important. Tamara pas 10 minutes join Anuja, to see people. So, yeah, and in that time they've got to tell you everything and you've got to work out what's going on. So I think, the more concise answers people can give, and I hope Ajni's session has helped people to kind of understand that a bit better. And Menka, your presentation was great. May presentations are obviously people can see them on YouTube again. So nothing more for me to do but to thank everyone for today's session, both of you particularly for taking the time and coming and doing this with us. And hopefully we'll do something similar again a bit later on in the year. I'm going to talk about our next session though, which is all about eye care. And we're going to have with us two amazing optometrists who deal with different types of eye problems. So we're going to have with us Bhavin Shah and Nehul Shah, who are going to come and talk to us about some of the current problems that we're all having with our eyes as a result of the pandemic, extra screen time, but also degenerative eye diseases and how to manage those. So please join us on the 24th of June, 8 o'clock, same channels, and hope very much that we'll be bringing another really informative session to everybody. And in the meantime, thank you so much, everyone. Thank you, Tushabai. I know it's a bit of a tight day today to do this, but thanks very much for joining us. Want to thank our tech team in the background, Nikunjbai and Hemoben, who have been managing all of this really well and keeping us to time. I do apologize, we're a bit late today, but you know, we had so many questions that we wanted to just try and cover them. So keep tuning in, keep watching the YouTube videos. I know, Menka, when you told me that your mom is telling everyone about them, so that's pretty amazing, really. And yeah, we're getting a lot of people watching them afterwards as well. So yeah, just keep doing that, because they've all been really, really useful sessions. So thanks everyone very much. Jai Jinendra, Pranam, and stay safe.
Thank you.